As you know, Diane, that is our principal concern, is to make sure that we, as a government, implement measures that will not overwhelm our healthcare system. That includes the hospital. None of us want to see the return to what we saw during the Delta virus, the fourth wave, with respect to the level of hospitalizations and deaths. We are in constant contact with the executive of BHB, and they are actually currently in level 2, and they are doing what they can to try to maintain these, of course, the standards, which is first and foremost, but also the level of services that are provided. You are correct. Omicron has impacted us with respect to persons that are on quarantine and or in isolation. Tomorrow, actually, I will be doing a press conference. So I'm giving you a little bit of a heads up to make announcements as to certain measures that the government is now going to be taking with respect to the period of quarantine and isolation, particularly in light of what's happening and the measures that are adopted in the U.K. as well as CDC. But there will be a press conference about that. But those steps will assist greatly, not just for BHB, but for other agencies where persons are in quarantine, where the period of time will be lessened for persons that are immunized and so forth. But all that, those details will be revealed tomorrow.
The delay in getting tests, I know, has been frustrating for everybody, and just trying to get it a little faster, and maybe in getting the faster results, if possible, again, and that's in contradiction to the concerns with the lab. Is the delay dangerous?
We live in this microwave society. We want everything immediately, but regrettably, all countries are challenged with the increase in testing. What we have done as a government, and we're trying to encourage personal responsibility. And in that regard, we have allowed for the importation of antigen tests. So people can go pretty much anywhere to purchase an antigen test so that they can have personal responsibility for their health. We cannot sustain this, Diane. This is not a sustainable model for us to be providing, all these services when we have antigen testing that persons can go and purchase and avail themselves of knowing their own status. And that's what we have to encourage, is personal responsibility. We need to get to the point of where we're living with this pandemic, and it's going to be here for, unfortunately, the foreseeable future. And we need the economy to continue. We need children to be in school learning, and we need to take steps. And in order to do that, we need everyone to be rowing in the same direction. And that means taking personal responsibility. Go to a grocery store, pharmacy, et cetera, pick up an antigen test, and you can test yourself.